Ehlers-Danlos syndrome, EDS, and fascia therapy. Generally speaking, and it can manifest in many different areas from the organs to, the outside of the body to both. But generally speaking, we're talking about hypermobility. Hyper means a heck of a lot mobility. It's too much mobility. So I want you to imagine, right, what happens in a hypermobile system. So we're going to start pretending, right, that Aaron is a normal system that Aaron doesn't have EDS. He's not hypermobile, and he has a fascial restriction. So the normative pattern, right, is we're going to see that little bit of a bend right there, okay? Now here's the kicker with people with EDS. They are hypermobile. So yep, that's what they're going to look like with this same fascial restriction. Okay? Why? They have the laxity to literally bend and twist a lot more than the average person. So the really good news is that we have found that Sterling structural therapy is highly effective at treating people with EDS. Okay? So literally every single person that has come to see us with EDS and associated chronic pain symptoms, their symptoms diminished massively and or went away. I'm not saying we can get rid of EDS, but I'm saying that treating the system appropriately, if you have EDS, can give you a much, much better quality of life.